Animal Emergency goes behind the scenes at some of the most sophisticated veterinarian clinics in Singapore, revealing the dedicated work of these medical professionals as they save the lives of Singapore's cherished animals. This week on Animal Emergency, Dr. Lai comes up with an ingenious plan to save a dog's leg from amputation.
Should work. I've done this before.
At the Singapore Turf Club, a critical dental procedure is carried out on a champion thoroughbred.
So I can't have it on the teeth for too long because it'll just burn the tooth. If the tooth is burnt, it will die.
And a dog battling heart disease develops serious complications.
You don't expect this to happen.
Unfortunately, Wally would die from the condition.
It's 9 a.m. Pet owner Kok Weng arrives at the Animal Recovery Centre with a Shetland sheepdog named Pirate. This is Pirate's second visit to Dr. Lai. Just 2 weeks ago, tragedy struck when he was hit by a car. Pirate survived, but suffered a terrible leg injury.
Yeah, my dog just got hit by a car. Can I send him over right now?
Bring your pet in now.
The toes and skin from his leg were completely torn off. Pirate was rushed to a nearby vet for emergency treatment. But the trauma was so severe that the vet suggested amputating the leg. Heartbroken with the diagnosis, Kok Weng took Pirate to Dr. Lai for a second opinion. Following the accident 10 days later, Dr. Lai grafts the injured foot to Pirate's belly.
Hello, Pirate. Ooh, on the side of his body, I slipped his leg underneath so that the skin from the side of the body will grow over it. The infection is gone, and this has healed very, very well.
Besides allowing new skin to grow, the treatment will stop the infection from further spreading.
Mom, I've done this before.
But this is only the first step to saving Pirate's foot.
Vets were going to amputate that leg. And I looked at that leg, I'm going, no, we've just lost the toes. He can still put the leg down onto the ground, but we need to help him. And I'm going to rotate it over onto this.
Dr. Lai is proposing to create a new pad at the base of Pirate's damaged leg.
To roll it backwards to cover the defect.
He is confident that this will be the solution. This is an option far better than amputation. If successful, Pirate will be able to use his hind leg again.
Stop shaking. Stop shaking. Book him in for surgery today. Without the toes, without the digits, he can still use it as a stump. And he should be all right.
It's a remarkable process that Dr. Lai is proposing. It's not without its share of risks. But if he gets it right, Pirate will soon be back to his active self. Kok Weng says his goodbyes and hopes his best friend will pull through this ordeal in good shape.
For him to lose his leg is like losing my own leg. Without his leg, he won't be able to jog. It's like end of the world for him.
Sit. That's right. Flashing. Flashing.
This is Wally, a 3-year-old Westie Terrier. Like most young dogs, Wally is usually very active and playful. But one day, Wally's owner, Jenny, a local doctor, noticed something wasn't right.
He was a bit breathless after running and all that, and he would be coughing, and he seemed a little bit more tired than usual.
Jenny reveals that Wally is already undergoing treatment for a serious heart condition. Her fear is that his health has taken a turn for the worse, and she is uncertain what could happen. Jenny takes Wally to his vet at companion animal surgery to uncover the problem. Jenny knows there is no known cure for Wally's heart condition. Wally's condition has taken a turn for the worse.
Wally is a very, very sick dog. He has congestive heart failure, so that means that Wally can't breathe. Now, to allow Wally to breathe, we've treated him with diuretics, but the diuretics have a disadvantage of dehydrating him and also causing the kidneys to fail. So, as opposed to having congestive heart failure, he also has a kidney condition, which can be made worse by the treatment.
Dr. Miles has been treating Wally since he was a puppy. He has been monitoring Wally's heart condition since it was first diagnosed.
He's lost a lot of water and a lot of salts. So as a result, he's actually very weak.
Jenny is hoping Dr. Miles can save Wally today.
You don't expect this to happen. It's just like for a child or a young person to go before their time.
Oh, Wally, you're a very poor thing, aren't you?
Back at the Animal Recovery Center, the vet nurses prep Pirate for the next stage of his skin graft operation. Pirate is sedated and quickly goes under. Skin graft operations are usually pretty successful, but with a dog as active as Pirate, there is always a risk of infection. The next stage to reconstruct Pirate's foot will require 3 hours to complete. Dr. Lai is very clear and focused on what he needs to do.
I think that's an interesting thing.
This one piece will make 52 layers.
Watch on mobile devices or the big screen. All for free. No subscription required. Download Veely now.
He has planned this well, and after a few last-minute checks, his team is ready to begin.
Okay, let's start.
Dr. Lai begins his intricate operation on Pirate.
So I'll cut it off from the chest, and then he can put it down and start learn to walk.
And Dr. Miles does what he can to save Wally.
There are no guarantees treating congestive heart failure and kidney failure.
And we head to the Turf Club to find out why even horses need a visit from the dentist. The veterinary equine hospital of the Turf Club manages the all-round healthcare of these champion horses. To keep racehorses in peak condition requires more than just the right food and exercise. When medical issues occur, quick, decisive action is required. Dr. Finn, an equine veterinary surgeon, is attending to a horse with a painful dental problem.
He will have a full set of cheek teeth, but some of the babies will still be there, so that's what I'll be checking for. Right, so this is a Houseman gag, and it'll hold his mouth wide open for me so I can check his teeth.
An adult male horse has up to 44 permanent teeth.
So we're looking for is the sides of the gums and the sides of the cheeks, looking for any sort of gingivitis or other small dental problems or cuts.
This horse is suffering from sharp enamel points in his molars. Sores from these sharp points have become painful, making it difficult for the horse to chew.
What we're going to do now is we're going to file some of these points off. Righto, let's hit the gap.
This is a grinding process known as floating. It is the ideal method of removing the sharp points that cause lacerations and scarring on the tongue and cheek. If Dr. Finn leaves the grinding tool for too long on the same spot, the friction could irreversibly damage the teeth.
If the tooth is burnt, it will die.
The timing of this dental work is critical. Waiting too long to treat dental problems will lead to further deterioration.
So it looks quite relaxed now.
With his dental emergency taken care of, this champion racer can go back to enjoying his food. Back at Pirate's surgery, Dr. Lai is measuring the amount of skin he needs to transfer from the good leg to the injured limb. Carefully slicing off Pirate's skin, Dr. Lai takes one of the paw pads along with a piece of skin and grafts it onto the injured leg.
See, that's what I've done. I've taken a strip from here. I've maintained a piece of skin, broad enough to supply the blood supply, bring it here, and glue it onto that. I need to have a piece of skin with it. If you just cut it off, you'll die. There's no blood supply.
Dr. Lai begins anchoring the graft onto Pirate's bad leg. The pad and skin are loosely attached onto the leg. Once this is done, Dr. Lai will have to take skin from Pirate's stomach and graft it onto the good leg.
I need to replace it because there's not enough skin here to close. You know, there's too much tension.
Dr. Lai carefully begins the procedure.
So now we're going to plan to close this. We're getting there, starting to come together. Once you plan your cut's done, the rest is just stitching.
The suturing is a long and tedious process.
We still have another half to do. Okay. Oh, my back.
After 3 long hours on their feet, Dr. Lai and his team finally finish with the stitching. Now, he has to reattach Pirate's bad leg back to the stomach to allow the skin to heal and grow. The surgery is finally complete.
All right, let's clean up. So now we're just waiting for the skin, this to grow onto and then the blood supply will come from this leg. It's no longer dependent on the graft. So I'll cut it off from the chest, and then he can put it down and learn to walk.
But just as Dr. Lai is about to bandage and dress his wounds, Pirate stirs from his sleep. The anesthesia is wearing off a little bit too soon. Back at Animal Companion Surgery, Wally is facing 2 very serious issues. And Dr. Miles is not feeling confident that Wally will make it through the night.
This treatment has very high risk because the more we treat his heart and reduce the amount of fluid in his chest, the more the kidneys can fail. And that could happen very quickly within days or weeks.
The prognosis doesn't look so good for Wally.
I was hoping to bring him home.
Oh, Wally, you're a very poor thing, aren't you?
You don't expect this to happen. It's just like for a child or a young person to go before their time.
A decision has been made. Dr. Miles will stop the medication used to treat Wally's heart condition in an attempt to allow his kidneys to recover.
There are no guarantees treating congestive heart failure and kidney failure. He could succumb to either condition.
Wally's kidney failure has dangerously lowered his potassium levels. Before Dr. Miles can start to address Wally's heart condition, he needs to get Wally's kidneys working properly again.
You can't treat one perfectly without risking the other.
To increase its levels, potassium is administered intravenously to Wally.
So Wally is going to be critical for a day or two while he's on a drip. He may get noisier breathing because of this, but we have to keep him on a drip for now to see how he is in another day and take another blood test.
Wally must stay at the hospital for a few days so the doctors can monitor his condition, much to the despair of Jenny.
Unfortunately, the blood test wasn't so good, so for his sake, he has to stay and he has to have a drip. Yeah, so it's very sad.
Pirate is in agony following his skin graft operation. And for Dr. Miles, will he succeed in saving Wally's failing kidneys?
I'm a bit worried, of course, but I just hope that it won't be too bad.
Back at Pirate surgery, things are winding down.
Put a urinary cath in him so he doesn't pee all over the place.
The anesthesia is wearing off. Pirate is stirring awake. This is normal, but Pirate is beginning to feel the full effects of his complex surgery. The pain is unbearable. Pirate cannot be further anesthetized as surgery is over. With Pirate in agony, Dr. Lai remains unfazed. He calmly instructs for painkillers to be administered. Slowly, Pirate calms down and he stops whimpering. Dr. Lai continues to dress Pirate's wounds and takes him to the incubation area.
It's called a bear hugger. It hugs them and it keeps their body temperature up.
After being anesthetized for almost 5 hours, Pirate's mouth is as rough as sandpaper.
Yeah, I feel a bit better, otherwise the tongue is so dry. Okay guys, I'm off to do a consult.
Pirate will have to stay incubated and be observed for a day until he fully recovers. After spending time on the potassium drip, Dr. Miles has arranged for a series of tests to assess Wally's condition.
He's a little bit apprehensive.
Not sure.
There we go.
He says, I get all sorts of needles stuck in me, don't you? But you're a very good dog, aren't you?
Mm-hmm, he is.
He says, I never complain. No, I don't.
Dr. Miles wants to ascertain if Wally's kidneys have improved.
It's okay. Don't be afraid.
Goodbye.
First, Wally's blood is taken to test for his potassium levels.
Wally says, X-ray time.
Wally's chest x-rays are taken to check if fluid in his lungs is still present. To complete the tests, Wally undergoes an ultrasound to evaluate the size and thickness of his heart chambers and if his heart is pumping efficiently. While the test results are being processed, Jenny waits anxiously with Wally.
I'm a bit worried, of course, but I just hope that it won't be too bad. Well, we'll see. We'll just have to take it one step at a time.
At the Animal Recovery Center, Gok Weng arrives to collect Pirate.
Hello, Pirate. Hey. I'm not so sure you're okay. Yeah, it's sleeping.
Pirate is still on the mend, recuperating from his surgery just the day before.
At first, I thought he was going to lose his leg and use his whole time with 3 legs. But after all the surgeries and treatments, I'm glad that he will be able to use his 4 legs for the rest of his life. He's adapting well. Yeah, he can even run now.
Pirate is up and about, running around with only 3 legs for now. Gok Weng takes Pirate home, but he will need to return for a 3rd minor surgery to remove the pouch once the foot has completely healed.
We are going home. Let's go. Okay.
Dr. Miles has managed to improve the function of both Wally's kidneys and his potassium levels. However, Wally still isn't completely out of the woods because he now needs to battle his other chronic problem, his congestive heart failure. For Wally, it's still a long road ahead to recovery. But for now, thanks to the work of Dr. Miles, Wally will live to fight another day.